Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I am your host, Dr. Kishore Volodi. And as you know, we've done quite a few podcasts on COVID-related issues over the past, almost a year and a half now, I guess. And a lot of it has been focused on the medical concerns that people have brought to us and being able to help hopefully navigate you guys through this pandemic with specific information related to Down syndrome. And as part of that, about a month, maybe a month and a half ago, I was invited to speak in Wisconsin at a virtual convention and conference that they were having. And in the process, virtually met Dr. Ruth Brown, who is joining us today on the podcast with a very specific angle when it comes to COVID, which is looking at the psychological impact of COVID on people with Down syndrome. But before we get into the podcast too far, Ruth, would you mind sharing with us a little bit about who you are, what you do, how you got involved with this kind of research in Down syndrome?
Yes. Thank you for having me on the podcast. It's a nice opportunity to kind of share a little bit what we've been doing. So I am a clinical psychologist, and my kind of research lately has been on the kind of mental health symptoms in people with Down syndrome. Originally, my training, like most psychologists, was focused on people with typical development, and we don't get a whole lot of training in graduate school for people who have developmental disabilities or other kind of developmental differences. And so it wasn't until kind of later in my training that I went to work at a residential center for people with developmental disabilities, and that was where I really kind of found my motivation and my kind of passion for working in this area, because it has been so neglected kind of as a field. We've neglected the mental health of people with developmental disabilities just kind of broadly. And so I started to work with the International Mosaic Down Syndrome Association. They were looking for researchers to study mental health symptoms because that was something that they had noticed, within the adolescents and adults, within their families. And so, we're looking for researchers to study that. And so, through some connections at Virginia Commonwealth University, where I am, Dr. Jackson Cook has been working with them for a very long time, and invited me to come out and meet with them and put together a study. And so we developed some surveys and kind of launched a pilot study, and then that turned into an NIH Career Development Award to help train me more in Down syndrome and to also try to help improve our measures or our ways of detecting symptoms in people with Down syndrome. Especially kind of self-report. I'm a big advocate of as much as we can gathering self-report data from the person with Down syndrome to really give them a voice and give them, kind of agency within their own mental health care. So, And so then when the pandemic hit, we were already putting together, collaborating with Lindsay Kozacek and some colleagues at VCU on just a survey of how families adjust to having a child with Down syndrome. We had put that together in collaboration with our local Down Syndrome Association, and we had that survey kind of ready to go when the pandemic hit. And so
Wow.
We decided to turn that survey then into, kind of, more of a focus on the impact of COVID on families who have a child with Down syndrome.
That's great. And I had a chance, obviously, to listen in and hear some of this preliminary data, but give our audience a little bit more of an idea. So exactly how did you collect the data for this study? Before we get into what you're finding in the data patterns now, what was the process? You were talking about a survey, things like that, but how exactly did that go out to families and things of that nature?
Yeah, so it's an online survey. And so we just started reaching out to, to the people that I knew with, various Down syndrome organizations, sent them, the flyers and asked them to distribute the flyers through their membership lists. And so it's an online survey. It's still active. And so if families are interested in participating, we're still enrolling people in it. And so we just sent out a call, through the support organizations, to say, we'd like to hear from you about how the pandemic is impacting you. And so parents could just then, kind of click a link and then take an online survey. And so this is a survey of parents or caregivers who have a child of any age with Down syndrome.
And as you, I think, this podcast goes out all over, really all over the world. So you were saying that you're still enrolling for this survey. Is
Mhm.
this something that you would want us to share a link on the podcast, or is it only for certain regions or only within the U.S.? Like who are you looking for?
Yes, so it is only within the U.S.
Okay.
But anywhere in anywhere in the U.S. we're it's English speaking right now, but we are working on a Spanish language version of it so that we can collect more more representative and data from families who often are kind of further marginalized because they don't have kind of the ability to answer those questionnaires. So we're working on that as well. So hopefully within the next few weeks we'll have the Spanish language version of that as well. But yeah, so anybody in the U.S. I would love it if you could share the link. I've got like a little short link.
Yes,
I
yes,
could share that, but yeah, but I don't know if you have show notes or something. But
yes.
yeah, the link to the survey is tiny.cc, so tiny.cc, and then slash, and then all in uppercase DSFAM underscore VCU. And that's where I'm at Virginia Commonwealth
Perfect.
University. So tinycc or tiny.cc slash DSFAM underscore VCU.
Perfect. That's easy, and I can put that definitely into the show notes for when this gets sent out there. So that's great. I hope it brings some more information. And as we now are at the point, I think where maybe we should talk about it. What are some of the mental health impacts that you've seen in your study data so far?
I think a lot of the results have not been terribly surprising. I think just because, for one thing, what we've been learning about how the COVID has been impacting just people in general. So like the APA has a Stress in America survey, and they have just reported the kind of widespread impacts of it. I mean, this is really impacting us just in every aspect of our life. And so we're seeing that for families who have a child with Down syndrome. And so as far as some of the impacts that it's having on the child with Down syndrome, in the questionnaire, they can, there's questions to check, have you experienced this? Has your child with Down syndrome experienced it? And so we've got about 58% have reported an increase in their child's behavioral or emotional problems. And 46% have reported an increase in sleep difficulties. And then I think one of the things that was, I think, concerning was that about a quarter were reporting difficulty accessing medical treatment or difficulty accessing medications, during the pandemic. And so I mean there were, I think, a lot of closures, and it was kind of more difficult to get into the doctor. More screen time. About a third were reporting kind of more time on screens, which I think between kind of virtual school and then also just being stuck in the house, and especially for places that had more restrictive shelter in place orders and things like that, there's aren't a whole lot of other options. So so those were the kind of the impacts that was having on the child. And then we also asked more information about how it was affecting the household, the caregivers and others in the household. And so again, we see kind of large impacts just in terms of missing celebrations and birthdays and holidays and things like that, difficulty doing hobbies, a lot of significant impacts kind of on the caregiver's work situation. So 3/4 were reporting that they had reduced hours at work or were furloughed. And then also caregivers were reporting a 63% increase, or 63% reported an increase in mental health symptoms,
Wow.
as well, which, I mean, it's kind of a significant stressor.
So Ruth, remind me again, the age range for the children you were saying in the study, does it go to 18 to 21, or is this all comers?
All ages, yeah. So we have families who have infants with Down syndrome, up to families who have adults, kind of middle-aged adults with Down syndrome. So one of the some of the the next steps with the study is to start to drill down a little bit more and look at how is it affecting families by age. Because that will have a big impact. I think in some ways, probably infants may be, experiencing less effects, whereas I think for adolescents, and adults, it's having, kind of more significant effects in terms of, kind of social isolation, disruptions of routines and things like that, I think is probably having more significant kind of mental health effects.
So this data that you just shared, all those stats you just shared, really is for not just children with Down syndrome, but really children, adults, and all of the family involved in their care. Is that correct?
That's correct. Yeah, it's
Wow.
impacting everybody.
Yeah.
Yeah. And we asked a little bit more details about kind of parental depression symptoms. So the caregivers are reporting kind of their own depression symptoms, and there's a screener called the Patient Health Questionnaire 8, which is just a kind of a broad screener. But based on the cutoff values associated with that, parents are reporting, pretty significant depression. So about 20% reported, or I guess almost 30% reported kind of moderate or greater symptoms of depression, kind of during this time also. So it's,
Wow.
it's definitely impacting caregivers as well.
And how many surveys so far did you say you guys have gotten in?
206, 261 so far.
Great.
Yeah, so it's
So
a
this
pretty
is
good.
pretty good size sample. And of course, you said you're still looking for enrolling even more,
Right.
which would be great to even get more data. What are some of the things that you've noticed that maybe have been kind of surprising in the data, perhaps things that you did not expect to find?
Yeah. I think some of the things that I didn't expect to find were some of the benefits. I mean, I
Okay.
think, it's one of these things that you take a step back and you're like, oh, course, that it makes sense when you kind of step back of it. But a lot of families are also reporting. So I think that the numbers I've got are kind of around 80 to 85% of the caregivers are reporting improved relationships and more quality time spent with their family. And 70% were reporting that they're more appreciative of things that they usually take for granted. And so I think that that's important too, to look at. I think it's easy for us to get kind of zero in on the negatives,
Yeah.
We like to do that as I think as scientists and journalists, and like kind of zero in on and those are important too, to acknowledge that it's hard and it's having these impacts, and we need to do things to try to mitigate those. But I do think it's helpful to see these things too, and to be reminded as well that there are some positive things that can come out of this, and the research on resilience, psychological resilience, tells us that we do need to focus on those positive things as well. We don't need to deny the negative things, but focusing on those positive things is helps us to be resilient. So that was a good reminder to see that.
Yeah.
And I think it was interesting at the same time, so the parents reported on, kind of whether they experienced the positive impacts or their child with Down syndrome experienced the positive impacts. But there were just fewer positive impacts endorsed for the person with Down syndrome. And so I think the highest positive impact was 38% for eating healthier food. And so I think that's interesting that's, that we're not kind of endorsing as many positive things for the person with Down syndrome. So I think that's, maybe an opportunity to kind of think about, kind of how can we help support and help the person with Down syndrome too? I mean, some of that may be age too, that if they're an infant, they may not be experiencing as many negative or positive things. It's just not impacting them as much. So some of that could just be a factor of age, but I think too, thinking through how, how parents can help to support some of the positive things, help their child with Down syndrome to, see some of the positive aspects of it could be beneficial.
Yeah. And maybe not directly associated with this study, but just with your background, are there things that you've seen families do that have been helpful for them during this pandemic in order to not potentially suffer some of those negative consequences that so many families have experienced?
Yeah, I think some of the big things, is maintaining in any way that they can social connections. And that, I mean, coming from, just the psychological literature, that social support is just really, really important. We're social creatures and we need social support. And that's true for people with Down syndrome also, maybe more so. And so the families that I've talked to that, that seem to be doing well, our families who have stayed connected with their, kind of local Special Olympics or, Down syndrome organizations who, who are kind of reaching out, doing Zoom calls and with, family members as much as possible, or staying connected with, with friends. And so, as much as possible, kind of having those social interactions, I think it has been really helpful for families.
Yeah, I can definitely say that. Personally, even in my own life, my brother went back to work yesterday. He's 46, went back to work yesterday for the first time since the pandemic started, now that he's fully vaccinated and the coworkers are all fully vaccinated. And he called me with such joy, like joy I hadn't heard in such a long time, because felt useful again. He felt like he was doing something, and for the coworkers to be able to say, "Hey, we've missed you," and things like that, I think is so important for all of us, but certainly important for people with Down syndrome. And I think seeing even over the past several weeks, now that all of his friends are fully vaccinated as well, being able to get together again and do some of those things that they used to do together, being able to do those again, so important. So I appreciate you bringing that up as well. Yeah.
And I think, kind of routines too. I think a challenge is going to be, kind of once, school start, I mean, I know some people have been going back to school and, kind of people are at different stages of that, but maintaining routines is also important, and like sleep routines and things like that, or I think other things that parents can do to help support their child's, kind of mental health symptoms of, getting good sleep and so it may be an adjustment at first getting back into that. And so it may be a slow, kind of plan ahead and take baby steps, kind of adjusting the schedules and reintroducing routines and everything to, to kind of get back on that. Cause that will be, we've got a big adjustment too, kind of ahead of us all, I think, as things start to open up and trying to decide what's safe and what's not safe still. And it'll be a process.
Yes, for sure. Well, wow, I really think that, the study data that you've shared, and also just realizing that it's still enrolling now. And so even more data is going to be coming from this eventually, I'm sure, to be released out to the public. But I do appreciate you sharing this preliminary information with all of our listeners. Anything that we didn't talk about already on the podcast that you feel like, boy, this would really be important for our families to know? I feel like we've talked about a lot, but you tell me.
Yeah, I think, I think we covered, what I would say the kind of big things, it's, I don't want to overwhelm families with a sense of all of the things that they should be doing. I think, like it's hard being a parent, and, and it's easy to feel guilty for all of the things that you could have, should have, would have done, and so I don't want to, kind of add on to that, other than to just say, kind of small steps and doing what you can and being willing to, kind of let go of the things that you can't control is always good. I think just good mental health and, survival skills are important.
Yes. Well, thank you so much, Ruth, for joining me on this podcast, for sharing this information with our families. I think it's an area that we're just learning really within the last 10 or 15 years, how important it is to look at mental health for everyone, but especially mental health for people with Down syndrome. I think has been an area that's been too long ignored. And especially during something as earth shaking, really, as a pandemic, I think it's so important to know how it's affecting people with Down syndrome specifically as well. So thank you so much for this work that you're doing and that you shared with us today. For our families, I want to encourage you, as always, please don't hesitate to reach out to us. So many of you have been communicating with me recently at Down Syndrome Center at chp.edu, and we love that. So please don't hesitate to reach out. You might say, oh, well, I don't know all the topics that have been covered. We've had over 100 podcasts and it's hard to know what's already been covered. Just reach out. There's no shame if you reach out and you say, hey, I'd love to have a podcast on something and we've already covered it. I'll just tell you we've covered it, or maybe we need to update it. Who knows? So please do reach out to us at any time, and we'd be happy to look into expert speakers like Dr. Brown here today to be able to share with us the information that they have as well on whatever topic you may have. But until next time, bye-bye.